This is the brow lift technique I use on like the vast majority of my patients. Super tiny incisions hidden behind your hairline using a camera. But here's the thing nobody tells you. Where we put the scar has nothing to do with where the brow gets lifted. The real key is what happens on the inside, how the surgeon releases the brow, how they lift it, and what they don't do. What your surgeon does under the scars during the surgery is actually the difference between looking refreshed and looking surprised. So I'll show you exactly where they are and what should happen in a brow lift. And stick around because I have a bonus tip. I'm gonna tell you the one question to ask your surgeon before you have a forehead lift. I'm Dr. Kian Eftekhari. I'm an oculofacial plastic surgeon, and all I do in my practice is eyelid and forehead surgery. So let's answer some questions. What does endoscopic actually mean? What is that word? So basically, the old school way to do a brow lift is that you go from ear to ear all the way across kind of the center of the scalp, way back on your hairline, pull everything back, cut out some skin, and suture it all together. That's called a coronal brow lift. In like the 1980s, surgeons became more comfortable using these small cameras working through small incisions to try to accomplish the same sort of thing. So endoscopic just means using a camera. Now, where do those incisions actually go? Most surgeons will do 4 incisions here and here. Some will just do here, and some will do a 5th right in the center, which never really made any sense to me, but some people do it for some reason. Now, this is where it gets kind of gruesome, and I don't want to scare you, but essentially what we're doing when we go in with that camera is we're using surgical tools to lift up that skin all the way down to here so that we can release primarily out here to allow that brow to come up. It sounds kind of gross, but what we're essentially doing is we're taking some of the scalp off the bone so that all of those forces that have pulled your eyebrows down as you've gotten older can be released and brought back up. We have to do it that way in order to get that kind of release. So what's actually happening inside those small incisions? Well, you might not realize it, but in a lot of cases when I go through here, I'm going all the way back to here, all the way around down to your bone down here, and all the way up along your brow bone. That is the whole area that I'm releasing through these 1/2 inch to 1 inch incisions. So the size of the incision does not have anything to do with the size of the surgery. The surgery can treat a rather large area through a small incision. That's the thing that I don't think people really understand. They think that just tiny little incisions behind the hairline aren't going to do very much, but in reality, through those tiny incisions, using the instruments we have and the cameras that we have, I'm able to release a lot of the face, and in some cases I can even do a middle facial lift or a mid-face lift. It kind of lifts the upper face, lifts the cheek through that incision from behind the temple. It's a great way to do a hidden procedure. Now here's the thing, most of the incisions are like 1/2 inch to 1 inch long, and sometimes you might think like, if it's a small incision, how could it really be doing anything? But it's not where the incision actually is that's doing the work down here. The incision just gives us that access point to be able to get our instruments in to slide into those tissues, get the camera in so that we can visualize things like nerves and blood vessels and avoid those things, to be able to safely do the work of lifting your brow through these tiny access points. So the size of the incision has nothing to do with the size of the effect. That's a misconception that people have a hard time getting around. So what does the surgeon do next? Once we can actually get in there and see what we're doing, we release some of these tissues that are really firmly anchoring your brow along the bone here. Right along here, it's very, very tightly anchored. So we have to release that tissue to allow that to come up. Once I get that released, then I have to get the brow held in that position so that you can have more of a long-term durable outcome. So how do you do that? There's a lot of different ways. People have used screws, they've used staples, they've used drilling holes in the skull, they've used implant devices. I've used all these things over time and they all have their different merits, but the key thing is that you have to have your surgeon explain to you somehow what they're going to do to lift it and anchor it. Because if they just tell you they're just going to release everything and there's no sutures underneath, just skin stitches to fix the incisions, that's not going to cut it for an endoscopic brow lift in my opinion. The one thing that I think people get totally wrong about this surgery is where you're trying to lift the brow. Hear me on this one clearly, unless you want to end up like a botched celebrity. So basically in the forehead area, you've got a muscle that goes across here to here, and it kind of stops out here right before it gets to your temple area. So in your temples, there's not really muscle to lift it. The muscle to lift your forehead is right here, and it just stops right about there and goes across to the other side. That's a really key insight, because over a lifetime of squinting, making facial expressions, smiling, all of this kind of goes up and down and up and down and up and down. You've got muscle here that can keep it lifted up, But out here, once you get some collagen loss, that gets really stretchy and then it sags down over time. 95% of the patients that come to me considering a brow lift have sagging out here. It's not necessarily a problem in here. That's the real key thing that I want you to understand. Because if a surgeon makes the mistake, in my opinion, of lifting the inner brow more than the outer brow, it just makes people look kind of quizzical, worried, anxious, surprised. And that's definitely not the look that you want to have. The other thing is that sometimes surgeons will go in and they'll cut out the muscles that make the facial expression right there, the muscles that make those 11 lines. So those muscles make lines that we don't generally like. A lot of people don't like those 11 lines, and we treat them with Botox. The problem is those muscles also provide cushioning and volume in the inner brow. And if you take away that cushioning and that volume, you're gonna get a little bit of a hollowed out, gaunt appearance like some celebrities have had. And I'm telling you, you don't necessarily want that. Also, it's very hard to reverse. When you take those muscles out, to get that volume back, to get rid of that gaunt face, very hard to do. Most important thing is you want your outer eyebrow to be higher than your inner eyebrow. Doesn't necessarily matter if you're a man or a woman. In general, for male eyebrows, you want it to be pretty flat, but at least equal from the outer to the inner. In general, for women eyebrows, you want to have a little bit more of an arch, and then it stays high after the arch. That's the real key thing. A lot of women have an arch to their eyebrow, but then it just swoops back down, and it looks kind of heavy on the outsides because of that anatomy. Everything goes back to that idea that there's no muscle out here to pull things up, but there's muscle right over here that allows you to make those facial expressions. That's why an outer brow lift is my most preferred option. Most of the time, all I'm trying to do is just get that outer part of the eyebrow to lift, and sometimes I'm trying to also lift the arch. I'm never trying to just lift the inner brow. That's going to result in that hollow, sunken, gaunt appearance that you do not want, I can tell you that. Now the next question is, who is not a candidate for an endoscopic brow lift? So most of the people that come into my office looking for a brow lift can have an endoscopic version. The ones who can't would be if you have a very, very tall forehead or a very receding hairline. It can sometimes be a little bit hard to hide those incisions, or it can further kind of stretch that and make your hairline look even higher. That's maybe not the best candidate. Those are challenging cases to do a brow lift. If you have a receding hairline, that's when you want to have a conversation with the surgeon about what the actual goals are and how to avoid more of a stretched forehead appearance. The next thing I always get asked is the eyebrow lift itself, just that part, going to fix the hooding of my upper eyelids? Most of the time, the answer is no. The reason for that is because in a lot of people, there's more of a jutting out of the bone out here that juts forward. And so if I'm just lifting out here, it's not necessarily going to go around and lift all that hooding up. Now, when I do a brow lift, I almost always also remove some extra upper eyelid skin because those two go together in most of my patients, but you don't have to. There are some people who just need to have a little bit of a lifting of the brow to give more of that rejuvenated appearance without removing some skin. The thing is, if you've got a really, really sharp, prominent bone where that bone is really sticking forward, you think it might just be like you have a heavy eyelid, but actually you've got a prominent brow bone. Sometimes I have to go in and actually trim down the bone a little bit just to give a better contour to that area. Most of the time when I do a forehead lift, I'm also doing an upper eyelid lift, which is called an upper blepharoplasty. Next thing I always get asked is, what's the downside to an endoscopic brow lift? Because everything has risks and benefits. So the benefits we've already talked about. The endoscopic brow lift, in my opinion, is the most versatile and effective brow lift surgery for most patients. Downside? So this is where it gets a little tricky. There's a nerve right here that is very close to where we have to release some of those brow tissues. If the surgeon cuts or injures that nerve, you could get some sensory disturbance going all the way to the back of your scalp that can cause feelings like spiderweb sensations, tingling, phantom kind of pain. Very annoying in some cases, but still pretty rare. The other type of nerve injury with a brow lift that is important to talk about is there is a nerve that crosses this way, and that's the nerve that helps you lift your forehead. So if that nerve gets knocked out in a brow lift, you could potentially have problems lifting your forehead. Big problem, pretty rare with an endoscopic brow lift, doesn't happen very much. Sometimes some of my patients experience a little bit of weakness of that area for a few months after the surgery, but most of the time it's not a problem. Just something to be aware of whenever you're talking about complications with any surgery. The last thing that people always ask me about with a brow lift is what's the recovery like? So you're gonna get some bruising, you're gonna get some swelling, 1 to 2 weeks for most of that. Honestly, some of the bruising can even track down into your lower eyelids. That's completely normal. It doesn't mean anything went wrong. It's just that, you know, when we have to release that area, you can get bruising in those areas. The thing about a brow lift is that some people can have some pain afterwards, but most of my patients do not need any kind of pain medication. You go home that same day, you rest. You can be active the next few weeks, but you don't want to be overly exertional. You don't want to put any makeup on your eyes, because often when I'm combining this with an eyelid lift, I'm going to have some incisions here as well, so you don't want to get anything like mascara, eyeliner, or eyeshadow in those areas. But the recovery is not going to be as intensive as some other bigger facial surgeries, so just keep that in mind as you're thinking about whether you want to have a brow lift. So let's go back to the very beginning. The one question that you've got to ask your surgeon if you're going in for a consultation for an endoscopic brow lift: what are you using to actually lift and fixate my brows? So some surgeons will go in and they will just release tissues and then put some stitches in the skin, not in the deeper tissues. I'm not a big fan of this approach because I don't think it's going to actually do the work of keeping the eyebrow lifted during that initial few month healing period, so that it can kind of set itself where you want it to be and pull back some of that laxity, some of that aging. I fixate my brow lifts with a combination of deep sutures where I'm anchoring the sliding tissue to the deeper tissue so that they can stay high. And sometimes I use implant materials that can stay in there from anywhere from 6 to 12 months. It just depends on the type of brow lift that you need when you come into my office. And if you want to get a consultation with our office, just go to eyelid.pro/book. So basically, when I'm doing a brow lift, I have to assess what the patient needs, where I want to anchor it, and sometimes I'm putting sutures all the way across that lifts the brow kind of concentrically, if that's what that patient needs to improve their brow height. So what's actually happening under those tiny little incisions? A full lift of your eyebrow and sometimes of your upper face. That's the important thing to know. Just because it's a tiny incision doesn't mean it's not doing anything. The key thing is you have to ask your surgeon, what are they using to hold up those deep tissues against each other so that you can have some longevity to your results. If you're looking for more videos on eyelid surgery, check out the other videos on our channel or hit the subscribe button. I'll see you in the next video.